head assessment. It's a little different than your average maybe geriatric patient or patient who's come in with a neuro issue. With our pregnant patient, they're basically healthy and they usually have no problems, but still there are some things neurologically that can occur with the patient. So we want to make sure that we check those out and make sure she's in good health neurologically. And so what we're going to be looking at, is she alert and oriented? And excuse me for not introducing, this is Pam Anderson. So she'll be our model for today. Today she's 28 weeks pregnant. And so we want to make sure, is she able to conversate with us normally? Is she alert and oriented ×4? Is there any headache, blurred vision, any dizziness, anything neurologically that she has a complaint of? And so that's our head assessment for our patient. Also, we'll be looking, of course, in her eyes. Are pupils equal and reactive to light? You know, does she look like she's in pain? So we're looking at all of those things when we're doing our neurological assessment. And then we go down to C. C, remember, is chest. And so we're gonna not only check her breath sounds, we also wanna check the actual breast. And so I'm gonna listen to her just as I would a normal patient. Have patient to breathe in and out, and we're gonna check all of our lobes. Also, we're gonna be doing a breast exam. So we wanna make sure that it's okay for the patient if we can check her breast. We always ask for permission, and she has said we can. And so of course, we're gonna get some gloves really quickly, because when we do our assessments, we always wanna have gloves on. So still using always universal precautions. And so we're gonna tell her we're gonna lift up her gown, and we keep her covered below and just raise up the gown. Pamela Anderson, is it okay if I check your breast? And she has said yes and consented. If you are a male student, you definitely wanna make sure you have a chaperone along with you, so that that chaperone can be a witness, and that makes the patient feel more comfortable. Again, asking, may I touch your skin? May I touch your breast? That sort of thing. And so we're gonna go around checking to see if she has any lumps or bumps or discomfort or pain or redness. Is there any leaking from the nipples? We do ask the patient, have you had any discomfort? Do you see any leaking, any milk, anything other than milk? And so that's how we're checking the breast. We also want to, at this time, remember, education is always the key with your patient care. So we want to make sure that we're educating as we're assessing. So we want to make sure, Ms. Anderson, are you doing your usual breast exams? Do you do them monthly? We want to make sure that she's aware of what a breast exam is. And so that's a part of teaching that we can do during the prenatal period. Then we're going to go to her tummy. And so with her tummy, we want to look and see and visualize, is it nice and rounded? Do we see it like a normal pregnant patient's abdomen? And so we're going to measure. And so still keeping her top covered, her bottom only exposing the area that needs to be exposed. And when we're doing our fundal height, we're always working from the symphysis pubis, and then we're working in centimeters, not in inches. And so we want to put the 0 right at the symphysis pubis and go all the way up to the top of the fundus, that rounded part of the fundus that we can feel. And so her fundus is right at 30 centimeters. So now she's 28 weeks, but she's measuring a little bit larger. So that is one thing we would want to investigate. Is she maybe having some gestational diabetic issues? Why is the baby measuring larger? So that would be a reason we would probably get an ultrasound just to see and get a very good estimate of the baby's fetal weight. Another thing that we're gonna do, well, I'll just hold that off.